They're already done.
Oh, that was easy.
Hello, hello. We are so excited to be here tonight. Most of you guys know me as Dr. Corinne Weaver, but there's a few faces I haven't seen. So I have been in practice here for almost 16 years. It'll be 16 years in February, which is kind of crazy to me. And I've done mostly upper cervical chiropractic. About 5 or 6 years ago, I started doing functional medicine. And what functional medicine is, we look at more nutrition and lifestyle changes to incorporate chiropractic. So I'm really excited to have Eric Chanley here, and what I brought him for is for regenerative medicine. A lot of people don't even really know what that is. So Eric, you want to take over and look at some slides, and we'll kind of share what you've been experiencing for the last few years.
All right, so I work in orthopedics at Novana Orthopedics in Cornelius, North Carolina. I've been doing orthopedics for 15 years, regenerative medicine for 2. Had a lot of good experience with this. So I'm going to go through this relatively quickly because a lot of these slides aren't super important. The important thing to understand is that when you're born, you have a lot of stem cells, and you grow really fast. So when you're born, if I tap your bone marrow where your stem cells live, and I pull that out, for every 1 stem cell, there's 10,000 other cells. By the time you're a teenager, it's 1 to 100,000. By the time you're 30, it's 1 in 200,000. By the time you're 50, it's 1 in 400,000. By the time you're 80, it's 1 to 2 million. So you ever wonder why a 5-year-old like smears himself across the pavement and it's totally healed in a week? Whereas the same thing happens to someone 65, they'll have that for 3 months. It's because they have less stem cells. And that's going to be the kind of gist, is you can't regenerate without these stem cells. So let's kind of get into some of these slides here. So just the center button clicks.
Yes, they're in this side one.
This one right here?
Yep.
No. This one.
Do it about right there.
Ah, there we go. Okay.
Yeah, there you go.
Yep. Regenerative medicine. Regenerative means, by definition, to bring it back to
Why do they call it regenerative instead of like, everybody's like this new term with stem cells, it's like.
Right, so when you cut yourself and your body heals it, you regenerate the tissue, because the scab falls off and you have new tissue. Okay, yes? Okay. So I would say that, what we do that's different is when you put stem cells into a joint, it helps that tissue regenerate. It helps it bring it back to life. So if you have cartilage that's smushed down, it helps bring some of it back. It helps you regenerate tissue. There's nothing we have in medicine that regenerates tissue. We put an artificial knee in, it's artificial. We put gel in the knee, it lubricates the joint, it doesn't rebuild it. Regenerative medicine rebuilds the tissue. This is complicated.
Basically just what you said.
Yeah,
Yeah.
but it's more complicated, people don't understand it. Okay. All right. So most people come in because they have pain. No one comes in because they don't have pain. And you have a lot of treatment options for pain. You can take anti-inflammatories. Anti-inflammatories help with pain, but they cause heart attacks, they cause kidney damage, they cause ulcers, they cause GI bleeding, so they're not without downsides.
Hence the book that I wrote, No More Meds.
Right. So this is the most important concept because this is probably the thing that comes up in the office the most. Okay, we do not use embryonic stem cells. These are not dead baby cells. Okay, dead baby cells were banned in the United States by President Bush. He outlawed them for good reason. If you inject them in people, they cause tumors. It's illegal to do it. You can't buy them in the United States. You cannot get embryonic stem cells. These cells that we use are umbilical cord stem cells. Okay? When you have a baby, there's a placenta and a cord. When you're born, they just take it and they throw it in the trash. But if they're going to harvest it, the patient undergoes a lot of testing. Those cells are harvested. They're kept for 6 months in a cryopreservation state, and then the mother's tested. And as long as no diseases come up, those can be donated to science. And those are the cells that we use. So they're very clean. They're only 1 day old, so they have a lot of growth potential, and they can never turn into a tumor because they're not from the embryo. The embryo cells are designed to make people and organs. These cells are just nurturing cells. Just like the placenta nurtures the baby, but it never turns into anything else, that's the difference. People don't understand that. This just goes in, it's a little more complicated. It's important to know that we only take the cord cells or the cells from the baby side of the placenta. If you go to the other side of the placenta where the mom's attached, that's where you're gonna have problems. So no one ever does that.
And they're all donated, right? Aren't they?
100% donated. Yeah, they're not getting paid for these things. They just know that if they donate in science, it's gonna help somebody. Just like, you know, when you sign your DMV card and you're gonna donate your organs, it's the same deal. Your family doesn't get paid for that donation. So a lot of people say, well, my body will react to these cells.
Yes.
It can't, okay? So your body recognizes you very simply by the sugars that sit on the membrane of your cell. These don't have those sugar proteins. They don't, the membrane's totally clear. That's why they're immunoprivileged. No one can have an allergic reaction to the cells because there's nothing on top of them yet, because they're 1 day old.
Try to get home and call you back.
So, another important thing that people read about is what type of stem cells they're getting, is that these stem cells that we inject into people, they live in your body part for about 7 days to 3 months, depending on how healthy you are. If you're very healthy, eat a very good diet, they'll last 3 months. If you're a smoker, they'll last 24 hours. Okay, but while they're in there, they'll secrete something. And that something is called an exosome. And that exosome is a packet of information. And that packet of information goes to your resident stem cells and activates them to start working again. Why do your stem cells stop working? Nobody knows. But they know this turns them back on to regenerate tissue. That's why most of this research is done for wound care, right? You have this horrible diabetic wound that won't heal. They take these cells and they smear them all over that wound, and then the wound finally closes. Now the thing is, in North Carolina, they didn't put Duke on here, but Duke's the major stem cell researcher in North Carolina. But Harvard's doing it, Stanford's doing it, everybody's doing it because we know this is the future, right? Using cells to make your body heal itself, because this does not have any downsides, okay? These don't cause cancer, these don't cause infections, these don't rip up your stomach, these don't cause strokes. Okay, you play. You play.
All right, let's watch the video.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, adult or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They are reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue.
That's how we're going. All right, you gotta, I was just gonna like letting people see the lab, so. That's the father, right there, the father of the stem cells.
Yeah.
I don't know if you know much about it.
No, I do. Dr. Kaplan,
Yeah, talk about him.
Yeah, so Dr. Kaplan was the first person to ever research these cells for the application of multiple areas. Most people are just doing stem cells for leukemia treatment. That's it. He realized that if you took these type of cells, mesenchymal stem cells, which you can get from umbilical cord, which you can get from bone marrow, if you injected them into joints, it would help regenerate the joint. But because these cells don't really do the work themselves, rather they secrete an exosome that activates your own cells, he wanted to rename them. to medicinal signaling cells. So if you ever crack open a book about immunology and about how your immune system works, there's hundreds of different chemical reactions, okay? This affects hundreds of chemical reactions in your body. That's why it works so well, right? It decreases inflammation, it decreases pain, it regenerates tissue, okay? His stuff is very hard to read. Neil Riordan is a doctor in Panama who does stem cells and has this guy's name plastered all over the first 2 chapters of his book because he pioneered off of his work, okay? And Neil Riordan was the person that said, hey, how about we get these from umbilical cords because they're 1 day old, right? So, is anyone a golf fan in here? Who likes golf in here? Anybody? Okay, I really don't like it. But I will tell you this. So the guy that won the US Open 2 years ago had a wrist injury, okay? And he's a wealthy golfer. He gets every treatment known to man and nothing helps him. Nothing helps him. He sees a doctor, it's like, we're gonna do stem cell treatment for your wrist. So what he does, guy's young, he's in his 30s, they do a bone marrow tap. So they go in through the back of his hip, they pound in there, and they pull out a bunch of cells. Now what I said before is how many stem cells does he have left at 30, right? So you had every 1 cell per 10,000 when you were born, 1 in 100,000 when you're a teenager. So he's got 1 in 250,000 cells. So he's probably getting 7,500 cells injected into his wrist. Miraculous recovery, comes back, wins the whole thing. Umbilical cord stem cells, you get 1 in 3 million. So it's kind of like money. Do you want me to give you $7,500? Or do you give you $3 million? I want $3 million. So I would pick the umbilical cord cells for that reason, but this research was first. That's why there's so much, if you go online and read research papers that say bone marrow, bone marrow, bone marrow, you can use bone marrow, but it's not nearly as many cells. And the fact is you want the exosome from the cell to do the work. Basic. Yeah, it's 1 in 200. Okay, now they're gonna go. So they're just going over the H thing that I talked about. Okay. Yeah, so like I said, when you're 80, it's 1 in 2 million cells of stem cell. They hook you. Okay, so here's another important thing. Blood flow. If you don't have blood flow, you can't heal an area. That's just basic stuff. So when people get wound infections, where do they get them? No blood flow here. They get them on the heel, there's no blood flow here. This increases blood flow, right? Because it helps angiogenesis. It helps you make new capillaries to get nutrients in there to heal it. That's why they use it in wound care all the time. Okay, so I'll tell you a couple stories that I have doing this type of therapy. So we had a woman, tennis elbow. She'd been everywhere. She had 2 steroid injections. She had physical therapy. She had the ultrasound of her elbow. She had exercises for months. She couldn't get better. She comes in, we're talking to her. One of our hand specialists, he does them all the time. I'm like, we can do a PRP injection if you want to give it a try. She's like, yes, I'm willing to do anything because she's not a good surgical candidate. Put it in, 3 weeks later, pain-free. She'd had tennis elbow for 2 years. 2 years, and she had unlimited money. And we just did a simple PRP injection, she was fine. Okay, but that's the difference, is you're rebuilding tissue because you're putting healing factors in. Yeah.
Yeah, we'll talk about PRP and
Yeah.
exactly what that is.
I'm just kidding.
Well, I think we're gonna get to it, but that's kind of like,
Yeah.
like when you're talking about how this all works together. Okay, so medications. I write tons of prescriptions every year. They help people, but it's not free. When I'm helping you with your inflammation, I'm increasing your heart attack risk. When I'm decreasing your inflammation, you're gonna hurt your kidneys. So this type of therapy doesn't have those type of side effects. None of those side effects exist with this medicine. Okay, now here's a big thing on painkillers, right? So when I started 15 years ago, there was something called the Patient Bill of Rights. Does that sound familiar to anybody? Patient Bill of Rights, you had it in all the hospitals? Okay, and when the 7th or 6th one was always to adequately treat pain. Okay, so what that meant was, we're just gonna have pain medicine for everybody. Okay, we're gonna drive it for everybody. Everybody gets pain medicine, everybody gets it, everybody gets it. Okay, the chance you get addicted to pain medication is 14%. Okay, I wrote thousands of these prescriptions. So some of these people had to get addicted to it. Okay, so now in North Carolina 2 years ago, there's a big cutback. So now if you see me in the office and you break your arm, I can write you for 5 days of pain medicine. And if you need more pain medicine, you actually have to talk to me about it, because they're that dangerous. Okay, and then the leading cause of death used to be accidents, now it's drug overdose. Like when I work in the ER, people come in 4 dead at a time because they don't cut the heroin, it's too strong, they put it in, they stop breathing, no one knows it, they're dead quiet, and they're all dead. So this is a real problem. Pain medication is a real problem. When we do surgery, we only write 7 days of pain medicine, then you have to see us because they're that dangerous. Yeah, so it's this for that. I give you an anti-inflammatory today. One of the things we were talking about before was steroid injections. I do 5,000 steroid injections a year. They help with pain. And then someone will read on the internet, Eric, does that accelerate degeneration? Yes. Does it raise my blood sugar? Yes. Does it make my bones, tendons, ligaments, and cartilage weaker? Yes. But I don't have another option, right? Because insurance doesn't pay for stem cells or PRP.
And
So
you
it's
can't
like,
sleep.
yeah. Yeah. No, I sleep fine because, I mean, I tell them. And people are always shocked when I tell them the truth. I'm like, hey, is this going to cause this? Yes. What's the satisfaction on knee replacement? 1 in 3 are not happy. 1 in 3 are not happy. Two-thirds are doing great. 2/3 have no problems. 33% are not happy with their knee replacement. So, I mean, if I had a knee problem, I would definitely consider this first. And if this failed, then I'd be like, all right, well, I'm going to have to roll the dice and take my chances. Hip replacement, we talked about before, much higher satisfaction rate. So I would try stem cells to avoid surgery, but if I was going to get a surgery, I'd pick a hip replacement. Unlike tennis elbow surgery, 50% satisfaction rate on surgery. Half. 1 in 2 are not happy. So if you two have tennis elbow, one of you is not going to be happy ever with the outcome of that surgery. Ever. Okay. Yeah, that's true. And here's the thing. Does anyone take Mobic in here? Like, you can't tell me because it violates your privacy. So there's only 2 anti-inflammatories that don't destroy cartilage. It's diclofenac and Mobic. That's it, 2. Every other one of these destroys the glue in your cartilage. So if you're going to take an anti-inflammatory, pick one of those 2. Okay. We knew we could talk about narcotics. Okay. So joint infection, that's 1 in a million. Nerve damage rarely happens. Thing around the skin, that's probably 1 in 1,000. Flare of pain in the joint, that's probably 1 in 10, right? Tendon weakening or rupture, extremely rare. Thing in nearby bone,
That's cortisone injections.
yeah. Thing in nearby bone, this happens. This happens. If you already have osteoporosis, you have to be real delicate with steroids because you can make the bone even weaker and then get a fracture. Okay, death in nearby bone. This we usually see when someone gets treated for pneumonia. They're on a long course of steroids and then they develop hip pain. And then it's because their hip's dead. The steroids killed it. And then we got to
This is
replace
all
it.
talking about where you couldn't sleep, not you can't sleep. They can't sleep because they're taking the cortisone.
Yeah.
The insomnia.
Well, I mean, it's for that.
Yeah, break.
I mean, they're dangerous medicines. That's why we have to have a conversation. And before we do a steroid injection, everyone gets a little chat. It's like, you can do this or surgery, and that's kind of where they are. They've done PT, they've tried a couple of things, and this is where they are. Like me, it's like I do an anti-inflammatory diet, take a bunch of nutrition, do a bunch of stretches, and then I do this. Oh, that's the other thing. So you talk about doctors. What they do during the day is not necessarily what they do when they leave, right? So most of the doctors I know eat organic, right? They eat organic because they just see if you don't eat well, you're not going to live. Yeah. So the more you do the steroid injection, the more likely you are to have a problem, especially with bone weakening. So we get very concerned if you keep coming in for steroid shots. It's like, listen, you could have a real problem in here. And surgeries have complications, which we talked about. Knee replacements, I mean, we do them all the time. We do them all the time. We do 100 a year. My surgeon that I work for does 100 a year. And then 33 of those people come in complaining that they don't like it. But they didn't have any choice, right? Because they weren't going to do this. They weren't going to do stem cells or PRP. It's like, yep, you had injections, you failed on medicines. What are you going to do, limp or get a knee replacement? Yeah. People die in surgery. It's usually anesthesia gets them. But when we do replacements, we worry about blood clots. So the chance of getting a blood clot from a hip replacement or knee replacement is 1 in 100. So we're going to see 1 of these a year, which is why you're on a blood thinner. But if you're unlucky, that blood clot will go right to your lungs and kill you, like a light switch. Okay. And then this is the national average. So it's 1 in 100 for a knee or a hip. So if you get 100 people in a room and do 100 knee replacements, 1 of them is getting an infection. And what do you have to do when you get infected? If you get an infected total knee, you got to take everything out. You put in antibiotic cement spacers, right, so you can move around on it, okay? You go on IV antibiotics for 6 weeks. Then we go back in there and we do the surgery 2nd time, right? So, people are like, I don't want knee replacements. I'm like, well, if they read anything on the internet, I can see where they'd be concerned. 1 in 3 aren't happy, 1 in 100 get infected, 1 in 100 get a blood clot.
It's really good to know these things.
Yeah.
Well,
It's good.
I give this speech every day. Every day I give this little speech. You know, knee replacements are expensive, and that's right. It's about $60,000 for knee replacement. Medicare covers it. Everyone covers it. Okay, just depends what your deductible is. And the rehab is long. So when I tell people, and this is short, so the rehabilitation just to get you walking without a walker is 3 to 6 months. For you to feel like that's your knee is 1 to 2 years. Okay, I'm not saying you're in pain that time, but if I, have you stand on your leg and lift up like this on an artificial knee, you'll tumble right over because you're still trying to get that connection between the artificial knee and your muscles. Like I said, insurance varies quite a bit. I mean, I'm sure you've seen deductibles that are incredibly high.
They keep going higher every
They
year.
keep going higher. Okay, so that's the main thing why I'm here. She's a chiropractor. She does a lot of functional medicine. So this is a good therapy because it has no downside. Your chance of infection from a needle sticking in your skin is 1 in a million. Okay, you can't immunoreact to the cells. They don't have any sugars on them. These cells regenerate tissue. We'll talk more about PRP. Stem cells do most of the work, but PRP, like Kobe Bryant, a couple other famous athletes, you take your blood, you spin it down, you get a layer of platelets. You suck the platelets out of that thing, and then you inject it into the tendonitis. PRP works great for tendonitis because it quells inflammation and helps tissue regenerate. It's fantastic. So we had a college player come in, 22 years old, last senior year. This is when he's going to go pro. Big tall fella. No one can fix his knee. He's at a major university. No one can fix his kid's knee. So he comes home on Christmas break, and he read about this, and he read about Kobe Bryant, and he's like, I want this procedure. So my doctor's like, well, you gotta see Eric, because I'm an ultrasound guy. This is an ultrasound guided technique. I'm like, let's do it. So we do it. Now it should take 12 weeks for this to work. He calls back in 3 days and says he's pain-free.
Can I get a number and call you back tomorrow?
Pain-free, played the entire season, did not go pro. He's happy. This guy's, he's 6'10". I had to put a stool on the other side of the table, hold his knee up. I mean, he's a very long guy. But he did great. He did great. Yeah, 6'10". Yeah, like this. Like I felt like a small child in front of this kid. But, we got him down. We did both sides of the tendon. And 3 days, he was pain-free. He's at a major university with orthopedic surgeons and physical therapists and athletic trainers and all the money in the world. And they couldn't fix it. Fixed it in 3 days.
The survey that you guys filled out is gonna be very helpful for us. And I know we don't have a lot of time for questions.
Right.
So what I was telling you is if
Yeah.
you have any questions, you just write them on the back of that survey. And I can even personally call you and answer those questions, because a lot of the questions that most people have is about them. So obviously we can't answer all the questions that we have, but we're gonna have some time to set aside next week and the next week to do some consultations individually with you guys if you are interested in this, but.
Right.
And you are doing this?
Me or Dr. Lisa or
Yeah,
Dr.
you
Sarah?
guys, yeah.
Yes, here. We won't be doing any of the injections. He's the pro,
Yeah,
that's why we
yeah.
got Eric here. But we're evaluating you guys to see if this is something that's for you. The whole reason we found Eric, we've been working together
Yeah.
since July of
Since
last
July
year.
last year, yeah.
July of last year, trying to find the right person and work all the details out. And I mean, it was just really God sent. I really feel like this is a perfect match. And there's so many things that I do here in the practice, but I know I have limitations. And so having patients come to see me about the same condition that I know I can't help, and knowing this is out there, I can't be, I had to be honest with you guys, hey, this stuff is out there, and we found, the right solutions so we can get this corrected for you guys.
And so we're the opposite. So I took all the stem cell classes, but because insurance doesn't pay for it, my clinic doesn't do them. So I see, 80 patients a week, and we'll chit chat about that, but they can't get it in my office.
They can't get it done because insurance won't pay for it.
Well, I'm part of a major hospital network,
Right.
and that hospital network's like, we're not doing these. So it's like, you can be as smart as you want, take all the classes you want, and read all the things you want. And, I've worked in several other clinics where I've done these, so I have the stories because I was like, all right, is this a lie or is this true? It's true. Does it help everybody? No, nothing helps everybody. That's why you have to go case per case and answer questions. Like, if you have cancer, it's a no for me. Some clinics will do it, I won't do it. It doesn't make sense, you had cancer 2 years ago, and I'm gonna throw a bunch of growth factors in your body to make everything regenerate. I'm gonna make your cancer regenerate. That's just common sense. You know, some people do it. I'm like, I don't know why you would do that. There was a doctor in Florida. These people had, you know, problems with their eyes. She injected their eyes with stem cells. That makes no sense that that would do anything, and she blinded them. Right? So orthopedics makes sense. It's like, it's been done. It's done in hundreds of clinics across the United States right now. Multiple clinics are opening up. I got a phone call on the way down here, like, hey, I want you to work in my clinic. I'm like, yeah, because I'm trained. You know, I've done 30,000 injections with ultrasound. I've done tons of regenerative medicine. So I know, you know, this is gonna work, this is not gonna work. And then something that she does that my patients don't do is you have to get your nutrition right. If you have poor nutrition and poor body chemistry, this won't work, right? If you eat like garbage and you smoke, don't waste your money. This will not work, okay? If you take B vitamins, a little vitamin C, you exercise a little bit, you know what a vegetable is, you'll get better.
Well, 'cause stem cells are
Americans,
good.
Americans don't eat vegetables. If you look at vegetable consumption in the United States, 1 in 2 Americans is not eating vegetables, and it's 5 servings, which is 5 fistfuls per day. They're not getting 5 fistfuls of vegetables per day.
Well, stem cells are also gonna go to where all the inflammation is. So if you have a lot of inflammation in your gut and you're having a lot of digestive issues, well, we gotta get that cleaned up first, you know, get the body, get the digestion right. And like he was saying, lifestyle changes, that's where we know that we will be successful with our patients, because we're gonna pick the ones that we know is gonna work for us.
Right.
So, I don't know, let's see, I can kind of go through these slides a little bit more.
Yeah.
This is just the survey
Yeah.
that you guys filled out. I kind of go through here. Yeah, so, I mean, these are the main things, right? These are the main things that you're obviously treating. We're not treating any eyes tonight, you know, so we're mostly looking at, knees actually number 1. I mean, would you
Yeah.
say knees that you're?
So like in my clinic, when I do my, like tomorrow, I've got 20 patients tomorrow, I'm doing 17 injections, 10 of them are knees.
Right, so.
So knees are the most common thing I treat. I've seen every knee problem you could possibly have.
Alright, so that's that.
We're talking about cost.
Yeah, so, I mean, costs
Time.
back in the day used to be
It was
hundreds.
$30,000.
I was gonna say 30,000, well, probably hundred thousands of
For
dollars.
one treatment.
Right, yeah.
For,
So-
no, in the cell count. Right, so the cell count, and the cell count was less than you're getting today. Right.
Yeah, so I mean, they used to pay, you know, tens of thousands or hundreds of $1,000s for stem cells, so definitely has gotten, we've made it more affordable for you guys. So it's definitely more affordable, and we are offering like different, affordable care, and we're offering the first 20 decide to do this, 30% off, 30 to 40% off depending on what you need.
Right, which varies person
And
to
it,
person.
yeah, it's gonna vary person to person on how many you need and what we're looking at. Some people are gonna like, I want my wrist, I want this, you know, so we're just, based on what you need, we'll give you an idea of what the price is gonna be.
And also if you're a candidate.
If you're a candidate, right?
Right.
Yeah. So this demonstration, all chiropractors say this, you know, like if you have a car problem, what are you gonna do? Are you gonna put duct tape when the oil change light comes on? No. Are you one of those person? Are you gonna make the change? Obviously, you're here, you wanna make the change. You wanna find out, you wanna take your car into a mechanic, figure out what's going on, get the problem fixed. And that's what we're doing tonight, telling you about this. I think I have.
We have one video left.
Yeah, well, we had the platelet. I know you kind of really demonstrated, but now you can
Yeah.
actually see where
Yeah,
the
so-
plasma you were talking about there.
This is the stuff you throw out. That's the stuff you're gonna inject, because this is where the platelets wind up when you spin it. So this, the new technology now is you'll have a little stopper in there. So you take whole blood right from the arm, you put it in the spinner. It spins it down, and it just goes by weight. Light stuff goes up, heavy stuff goes down. Red blood cells are heavy, they go down. There's a little piece of wax in here, and then you've got the good stuff up top. You just draw this up into a syringe, and then you put it, this is so good for tendons. And the other thing is, this stuff is like a booster or a miracle grow for stem cells. So the first stem cell injection, you always want to put a PRP in there, and then usually wait 2 to 4 weeks, then you put another PRP injection there, because it helps it keep growing, and then you put in the last one in, usually 2 to 4 weeks after that, depending on how bad the arthritis is, how bad the nutrition is, things like that. Yeah, so here's the picture. Blood, the little gel layer in between, looks like wax, and this is the stuff you inject.
I guess I don't understand. Can I ask a question?
You can ask a
Yeah,
question about that,
just
sure,
about
yeah.
that.
So is that your blood? I mean,
It's your blood.
my blood?
Yeah, I'm up.
Okay.
I'll do mine if you're gonna do my tendon.
All right.
Yeah, because you can't react to yourself.
You take it out and then you spin it or something? and put
Yeah,
it
so
back in?
literally,
Is
I'm
that
gonna
what
walk
you-
over here. Literally, it's this
Okay.
easy. You have your arm, you're in a nice
Alright.
comfortable chair, I stick the little thing in, blood's coming out nice and easy.
He does
I'm
the
good at-
best
I'm good at
injections.
this.
He's so good at this.
All right, now I've got 1 to 2 vials, depending if we're doing a knee or a small joint. We only need 1. If you're doing a knee, you just take 2 tubes. Now I've got 2 tubes of your blood, little Band-Aid there for you. You're good. You're relaxed.
That felt great.
Put them right in the syringe. Put them right in the little spinner. Spin them for 7 minutes, and in 7 minutes I'm gonna line up with this.
Okay,
So
got it.
I've got a little rack. Put the little one in here, one in here. Pop the top. I get my little syringe, you know, the thing I'm gonna inject you with. I take a really big, thick needle so I don't sit here all day drawing it up. I've got half. I come over here, I get the other half. I'm like, this is trash, this goes in a little red box. We never worry about this ever again. This is what you don't wanna drop, because I just got it. So then, if you had tennis elbow, what I do is, you know, we clean the area, and then we prep it and just get that whole area under the skin with that, okay? And then it's done. I mean,
And PRP is a lot cheaper than stem cells.
yeah.
I mean, a
It's
lot
tremendously
cheaper.
cheaper, yeah.
So it's
Because you're providing cells.
Right.
Right, when you use stem cells, you had to ask some lady who's already pregnant to undergo a bunch of lab testing that,
And we have to ship them over.
yeah, and then they have to be frozen, and then they'd be held for 6 months, then she has to be retested, and then that sample has to be retested. And the testing is
Okay.
expensive, because you're
Now
getting
I
tested
get
for
it.
HIV, hepatitis, you know, Zika virus. I mean, all these things have to be checked to hit FDA guidelines. And in essence, and it's FDA approved.
And yeah, the thing is, we'll determine if you need a PRP versus stem cells or both. You know,
Right,
and
yeah.
that's kind of where the difference of the prices are.
So if you do different areas, then that's the same, you know, this is gonna be.
Well, bigger
You
joints have
can't
more
get it
cells.
done,
So
you
like a
know, for
wrist-
3 places if you do one.
Yeah, like a wrist and an elbow, right? Those are small areas. They need like 1 cc of stem cells. A knee, depending on your size, like I got a chicken leg, it's only 1 for me, 1 for you. But you get some fella his height, that's 2 cc's. His knee's too big. You have to put 2 cc's in that. That affects the
Okay,
price.
depends.
Yeah, you were kind of talking about some of the athletes and stuff that first started the.
Yeah.
But yeah, well, I think we pretty much, those are really good questions that you asked, Kathy, so. I think we got everything covered.
If it works that well, why is insurance not?
That's always a good question, yeah.
Yeah.
Why does insurance not cover
Right.
chiropractic?
Yeah.
No, wait,
Why
that's
does
a,
insurance get
well,
wrapped
I mean,
in?
because the thing is how big do you think these research studies are? On arthritis joints. So, if you go around the world, right, we're dead last in this. So there are 10-year follow-up studies, 10-year follow-up studies for stem cell injections coming out of China and coming out of Hong Kong and coming out of Japan. 10-year follow-up studies. So they've been doing this for almost 20 years, okay? And the reason why is, I mean, for them it's expensive because it's new, right? You have to make the cells, right? So what they do in other countries is they make the cells. So they take a placenta, 1 placenta, and then they get zillions of them. They clone them to get millions of cells. And if you look up Neil Riordan, that's exactly what he does. So if you go to Panama, it's 35 grand. He takes your cells. You go back in 2 weeks. He takes his favorite stem cells that he's gotten from other things for other conditions. So he's got a stem cell line for Parkinson's. He's got a stem cell line for COPD. He's got a stem cell for spine arthritis. So he's got all these things. He mixes them together. You get 100 million cells in the IV, and you get 100 million spines injected wherever you want, right? And that's it's $35,000. This is way cheaper.
I've been
We don't
sending
do-
people to Mexico actually in the last.
I go to Panama, safer,
Yeah.
nicer digs. So when you do that, it's like, okay, that's $35,000. Do you think your insurance company wants to pay for a $35,000 treatment?
No.
They don't, because I get on the phone, because they won't cover an MRI, that's only $2,000. So I get on the phone every week and I talk to an insurance carrier about that, because the thing is, the research is early. If you had 10,000 people for a stem cell study, you would do it, but no one's had a 10,000 person study, period. The biggest study I've ever seen on stem cells was 72 people. And would you make a decision on 72 people? And a lot of people are like, no. And like, what were the adverse outcomes? There were 0. So in Japan, they let you have an experimental license. So you have 7 years to prove that it works or it doesn't work, okay? But that's a federally, like, their government runs their healthcare. So the government says, okay, we'll try it, and you get a patent. Or you can come to our country and you can prove yes or no, this medicine works. Okay, that's not how it works in the United States. In the United States it works, it's like, okay, you think it works, go to the FDA, I need 5,000 people in a study, who's paying? So that's why it's not covered by insurance.
But you were saying that a knee replacement is like 35,000 and the insurance covers that.
It does cover it, 100%. Yeah, and not 100%, whatever your
Because
deductible is.
it's
So
not
like,
experimental.
yeah, it's not experimental. They've been doing knee replacements since the 70s. First knee replacement lasted 5 to 7 years. Knee replacement put in today, if you put in 65, that knee replacement will last you 20, 25 years guaranteed. It's a lifetime replacement for most people in the United States if you put in 65. So the
It's
thing
more
is,
that it's experimental than the cost of it.
so what?
It's more that it's experimental than the cost of it.
And the cost, because if it's experiment, like, there's a lot of like things, like people wear, like a lot of splints. Those are all experimental. There's no 10,000 person study on half these splints that people use, and insurance covers those every day. You know, like, so I do a boot for a fracture, great, there's great research on that. Knee braces, there's no good research on that, you know? So it's hit or miss, it's very hit or miss. And, you know, they will pay for autoimmune disease medicines that are $1,500 a month, but
Autoimmune for stem cells?
no, autoimmune, like Humira, those type of medicines.
Oh, right,
So
right,
it's
right,
not like
right.
100% money driven, it's just that they
And
will-
diabetes?
Yeah, $700,
Diabetes, I
$800
mean,
bucks per
they're
medicine.
losing money every day from that, just diabetes, diabetes.
Yeah.
right? Okay.
Yeah, so, but I mean, there's a reason why some things get covered, some things don't. Stem cells, I'll tell you exactly what's gonna happen. You could write it down on a piece of paper, 8 years from today, almost on the button, I think, 8 years from today, is they're gonna patent that exosome product, okay? So right now, a bunch of people do, they're cracking exosomes, and they're trying to figure out what that chemical is, and once they can patent it, that's gonna be your medicine. And you'll come in my office, in my career, and I'll be doing just those. And your insurance will cover it. And I suspect it will be 8 years. Because I talked to people that are doing the research on that. I said, how far out are we? They're like, 8 years, we'll have something patented. Because you gotta remember, that means they're 3 years away from figuring it out, and then 5 years to get through FDA trials. So it's coming.
I know we're not talking about pediatrics, but there is a lot of stem cell research with autism, and Duke is doing it.
Right.
But right now, they're mostly going to Mexico because they couldn't get into the Duke, and, years later, we are seeing, but I am seeing children that are nonverbal going to Mexico getting stem cells, and then now they're verbal. So we know the powerful, like, why is the United States doing this? Why do I have to send children to Mexico to
Yeah,
get this done?
right.
Why are we not doing this? But again, Duke is doing the research, but it's just taking so
Yeah,
long.
the good news is that America's slow to institute anything. That we are.
Yeah.
And that's good, because we miss a lot of bad things we miss. On the downside, it's like, everyone knows this has been out for 20 years, no one's had bad reactions to these cells. The only thing that's gonna happen is nothing. That's what's gonna happen, nothing. I mean, I've had people I injected, nothing happened. They're like, I'm no better. I'm like, I'm sorry, I mean, I know it went in, I was right here, and it didn't work. But I've also had other people come to me, it's like, 22-year-old basketball players, like, this guy's seeing real heavy hitting orthopedic surgeons, like, can't help him. And I'm like, we do one injection in the office, and 3 days later, he's fine. He had pain for 2 years. Who had a question? You, sir?
So, if all these other countries are doing this, and they're doing it for years, are we not, in the United States, we're not talking to them? We're not using the
What do you
research?
think? I mean, half these researchers that
We're not like piggybacking off of their efforts and experiences, all this?
right, it's illegal to clone cells in the United States. So there's a guy who runs a huge clinic out of Colorado, okay? And he knows the more cells, the better. So what he does is, he takes your bone marrow, okay? I'm gonna guess that you probably have like 1 in 400,000 if I take your bone marrow. But I can get it. And if I get that cell, I can replicate it in the lab. That is not a problem. That technology has existed for years. Put in the lab, I can get you 100 million cells. That's illegal in the United States, because then you're making a medicine. So our own laws stop us from
So
doing it.
are we in conflict with the pharmaceutical industry? Is that a problem?
Well, I don't want to be killed on the way home.
Yeah.
In a horrible car accident with
Right.
no other cars around me.
Is that a factor?
But the thing is that, I mean, you have to think, it's like, okay, I understand it's expensive, I understand that. But why is it that people that have millions of dollars constantly go to Panama? So if you want to listen to something on the way home, peel up, Joe Rogan Podcast, 1066, Dr. Neil Riordan. Okay, Mel Gibson's dad went to the Mayo Clinic, which I went to school in Iowa, is revered as probably the best diagnostic clinic in the entire world. He goes there for a workup, great story, you can listen to the whole thing. He goes there, they evaluate this guy like, hey, he's got heart failure, kidney failure, he's gonna die. There's nothing we can do. As it turns out, Mel Gibson's a famous actor who has a lot of money. So he asked all his Hollywood friends where he should go. And they're like, 3 times, and that's my rule, 3 times. Neil Riordan will save your dad's life. They go down to see Neil Riordan. Pull up how his dad's doing. He's doing fantastic. It's unbelievable, right? Right? The future is here. It's just not evenly distributed. right? Because like Peyton Manning's had stem cells, they didn't list it on there, he's had stem cells, okay, in his neck, and he's not doing it in this country, okay?
So I coincidentally, I talked to a guy 2 weeks ago, and he's telling me that he is he's acting like an agent for all these countries outside the United States, working with regenerative medicine. And he's saying the number one reason they won't do it here is because it will cost the medical industry trillions of dollars once this is in place.
Well, see, that's the thing. It won't be the way they're doing it, because they're gonna patent that exosome. So I can grab her stem cell, I can't patent it, it belongs to her. I crack it open, I get the chemicals out of the exosome that do the work. I change them just a little bit, and then hopefully I don't change the function. And by doing that, now I can patent it. So there's a chemical called insulin, right? And insulin prices went up 300%, even though it's never been cheaper to make it. Ever in the history of man has it been cheaper to make insulin. Insulin's through the roof. Epinephrine has saved people from dying from peanut allergy. Went up 300% in 18 months. Why? Because they can do it. Right. Well, they can do it. Well, they just have the ability to do it. So there's good things about being American and bad things about American. It's like, there's conflicting interests. And that's not really the point of tonight's lecture. I mean, if you want to go down some rabbit holes, you go down some rabbit holes and really see how that thing works. But I would say in a general sense, it's new. There's not huge research on it. There's tons of people that are getting good results with it. I have personally worked in several clinics getting good results with it, and I'm just a great injector. So I'm like, I like doing it. So I will do it. I do cortisone injections. Do I tell people? And people are shocked when I tell them, like, yeah, degenerative cartilage. And like, what else do you want to do? I'm like, I go, well, if you're in this model and what your insurance will pay, if you just do what your insurance says, if you don't want the shots, we replace the knee. I mean, what else do you want us to do? I can give you a cane. I mean, if you want an intervention, that's it. I mean, you go to the American Academy of Orthopedic Surgeons, the interventions are short. It's like, and it's published by the government. Anti-inflammatories, injections, either gel or steroid, knee replacement. Done. That's it. Does Medicaid cover physical therapy for knee arthritis? No. Would it work? I don't think it would, because you're missing cartilage. It's just gone. So, it doesn't make sense to me. You ever had a tap of the bone? People will tell you it doesn't hurt. I know a guy in Charlotte who taps bone. We were chit-chatting. He says it does not hurt. I'm like, listen, I've been to 3 of these seminars and live seminars with live procedures on live people. Not a single one of them didn't cry out in pain when you did it. And that doesn't include the inflammation and pain when they leave, okay? And doesn't account for the fact that, what she was saying, when you tap bone, it's very inflammatory, so when you put those in the knee, some of those babies are gonna run right to that hip joint in the back, because it's like, that's the biggest area of inflammation, not really this knee problem. So a stem cell secretes something, okay, that activates stem cells that makes it heal. PRP is not that. PRP is platelet-rich plasma. I take the blood from her, I spin it down, and then I inject just the good portion back into that injured area.
The healing part.
The healing part back, yeah, I put the healing part back in, and the inflammatory, which blood is very inflammatory, goes right into a little red, goes right in a little red bucket. But we use them together because this guy, the longest this guy's gonna last is 3 months, right? But I can shake the dog and make him work harder if I put the PRP in, so he doesn't fizzle out before he hit that 12-week period of time. So that's what we do. Two different things. Like tennis elbow, I commonly just do PRP, and I'll keep stem cells in my back pocket if it doesn't work, because PRP works like gangbusters. For horrible knee arthritis, PRP is not enough. Like if you say I want PRP for my knee, I'm like, you better be 22, right? Because if you're my age, that is not going to work. But if you want to try it, right, we'll try it. There's no harm, right? Because I've already done it a bunch of times. I know nothing bad happens. Oh, it's swollen. I know it's swollen. I just put extra stuff in your knee. It will go away. Your body will absorb it, because what happens when you break bones? It's the same stuff. When we do rotator cuff surgery, you know what we do? Right where we're going to fix it, we tap the bone. Why? To release the stem cells. We do that all the time for almost any tendon repair. If we're going to repair your tennis elbow surgically, we take the tendon off. We shave the bone. We tap it, and then we put the repair on, because it works 10 times better.
People are asking about the massage room. Well, massage room is now Eric's room.
Yes.
We're not gonna do massages anymore. We're gonna start doing some stem cells.
There's a lot of massage therapists. There's not a lot of stem cell injectors.
Right.
Yeah. Yes, sir.
So this only works on inflammation and arthritis?
No, well, that's what we're talking about tonight. So let me tell you, I have a friend in Wisconsin. You can look him up, Michael Johnson, good friend of mine. He does stem cells, okay? He loves treating COPD, okay? He loves it. And I'll tell you why. Because you Google Michael Johnson, stem cell COPD from Appleton, Wisconsin, you're gonna see a great video. Guy comes in to his clinic, knows he does stem cells, and is like, hey, I just saw the pulmonologist, Wednesday COPD. He says, there's nothing you can do for me, I just need to go home and die. So Mike Johnson is a functional medicine doctor, says, well, let's take a look at this and see what we can do. So, puts on nutritional protocols, and he's like, he goes, I really think you do well with stem cells. Now, when you treat COPD with stem cells, you do it IV, okay? So he puts him on IV stem cells. The guy has a miraculous recovery. And it's very popular. If you Google stem cell COPD, a lot of people do really good with it. So, he goes on TV. For whatever reason, I don't know how the TV guy found him. He goes on TV, more on, I think it was Channel 3. It's like, Mike Johnson saved my life. And that's just how it starts. And then they go back around, they see him in the clinic and talking and get, he got a fake treatment that day for the cameras and everything. But, I mean, they're used for everything. Wound care, they're used all the time in wound care. Complicated diabetic wounds that will not heal, they do stem cell therapy. It's just that we're musculoskeletal people. I'm an orthopedic person. I focus on that. If I had COPD, the medical board frowns upon IV stem cell therapy here in North Carolina, I wouldn't do it. I'm not getting in trouble, not getting one of my friends in trouble. I'm gonna march on down to Panama and get it right in the IV. That's what I would do. But yeah, if you look up, PubMed is my favorite research site because it's free, and it's all literature that's published by major universities, and to put in COPD stem cell, wound care, I mean, it just falls out of the page, and there's thousands of articles, you can't even read them.
So like, if you just had scar tissue under your knee from like just previous injuries?
Well, if it's just scar tissue, I mean, I do surgery, because you can take it out. I mean, you take
If
scar
it's
tissue.
just scar tissue.
Yeah, if it's just that.
It's just scar
Yeah,
tissue.
but, I mean, I've yet to see scar tissue without some arthritis in it. And like if you're having mechanical locking symptoms, like, just take it out. I mean, we do that, that's an easy surgery.
And that's why I've been in here practice for 16 years. I have seen patients for 16 years. Because what happens is when they first meet me and their spine has been destroyed, degeneration and all of this, and I can get them up and walking and moving again, they want to stick with that. They want to maintain that. They don't want to just stop coming in because they think, I'll tell them, if you stop, what's going to happen? You may go back. So we want to keep that regeneration happening.